Hi, everyone. I am Dr. Lynn Wagner, and you are listening to Doc's Thoughts, part of the Wealthy Life. Ladies, I have to tell you something. I have this conversation with nearly every woman in midlife in my practice, especially as their hormones begin to shift, which happens to all of us. And it's a conversation about their vagina. And here's how it normally goes. I say, we take care of our bodies, our faces, our skin. You're obviously in the clinic to take care of your health, but how many of us are neglecting our vaginal health? And I would tell you it is a lot of us, and it is definitely not talked about enough. So that's why I want to talk about it today. Because when we're in our reproductive years, our ovaries are in full swing. We're making estrogen, progesterone, testosterone, and those hormones are literally bathing our tissues throughout our entire body and keeping them healthy and vibrant. But as we transition into perimenopause and beyond, those levels begin to drop and things begin to change. A lot of women obviously know the common symptoms of menopause: hot flashes, mood swings, weight changes, dry skin, joint pain, brain fog. I can go on and on. If you're there, you know what I'm talking about. But guess what? Your vagina feels it too, because your vaginal tissue is full of estrogen receptors. And when those levels begin to drop, tissue down there changes. And it's actually called vaginal atrophy. This is how I explain it to my patients. I say, imagine a beautiful flower, and you're watering that flower, you're fertilizing it. It's soft, vibrant, colorful, alive. But if you don't do those things, it's going to start to fade and wilt. And that is literally the same thing that happens to your vaginal tissue. So we want to think of taking care of that area like we're taking care of a delicate flower. So here are some of the things that I tell my patients to do to take care of their vagina. Nothing is in order of importance, but I'm just going to give you a nice list of things you can consider. I would say most common is replacing the hormones that you have lost. So there are these beautiful estrogen inserts or creams that you can apply to the vaginal tissue that have estrogen in them, that are basically giving back what your vagina is lacking. Some of them will include DHEA. I would definitely recommend getting them from a physician who knows how to prescribe them. I wouldn't buy them online, but they work beautifully. Women love them. And usually you use them like twice a week. You start every night for a couple weeks, and then once things are getting back to normal, you just maintain a couple times a week. So it's super easy, very affordable, and works very, very well. But there are some other things you can do as well. And a lot of women will layer these things together. So there's, 5 or 6 things I'm going to talk about, but maybe you pick 2 of them and use them for your vaginal care, and you're going to get excellent results. So one of the things I'll do with my patients is actually have them see a pelvic floor specialist. So these specialists are PTs specifically trained in the pelvic floor, which is all of those muscles and architecture down there. As they're working on that area, they can sense if you have too much tightness, too much looseness, and they can improve muscle tone. They can improve blood flow and release tension. And they can also give you exercises to do at home, because let's be obvious. It's obvious if you do things regularly, it's going to work better than just seeing a therapist every once in a while. So they give you tools to use at home to keep things healthy. Another cool thing that I love recommending for my patients, especially if you have any type of autoimmune inflammatory disorder down there, is actually red light therapy. So obviously you can buy red light panels, but I think that's kind of awkward because you'd have to stand there with your underwear off. I don't know how that would work. So the cool thing is they actually make these wands that you can insert into the vaginal tissue, which will give that internal red light therapy, which can do all of the wonderful things that red light does. The specific one I'm talking about is called Joy Lux, available online. I think it's an excellent product. Another thing to think about is like the moisturizers and the lubrication down there. So if you're using a moisturizer, first thing to think about, or a lubricant, I want you to think about, is it a clean, body safe product? So there are apps you can use on environmentalworkinggroup.org, EWG.org. There's websites and apps that will actually let you scan products to see how healthy they are. But for lubricants, there are things like Aloe Cadabra, Uberlube, Good Clean Love, or you can even use coconut oil, almond oil, or jojoba oil. So if you have dryness with intimacy, even though you're doing the other things, you're going to want to use a nice, healthy lubricant. And like I said, there's also moisturizers. You want to do the same thing and scan the label to make sure it's healthy, because vaginal tissue absorbs a lot. So it's going to go straight into your system. Things like Reverie, Good Clean Love. Those are great for anyone, especially women who can't use hormones for specific reasons, because they're going to hydrate that tissue and improve comfort, even if you can't get the benefit from using hormones. And then important thing to think about is use it or lose it. So a lot of women, as they get older, have less sexual intercourse. That is very, very normal. Libido goes down, their partner's libido might go down, they might have chronic conditions. So that is very normal. But if you are able to, having regular vaginal intercourse or stimulation down there will increase blood flow to maintain that healthy tissue. Pleasure is literally medicine. So if you're taking care of your skin and your hair and your nails, but you're not taking care of the private area, that is equally deserving of care, because a healthy vagina is part of a vibrant, powerful, whole woman, and you deserve nothing less. So I hope you enjoyed that video, and I will talk to you soon.